The honourable member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health and Wellness. I heard last week from a Glace Bay resident who is at the end of her rope when it comes to the staff ratios in nursing homes. Her mother, who has dementia, has suffered 4 unwitnessed falls in her nursing home over the course of the past 3 months. Each of these falls could have been prevented had there been appropriate staff on hand. Unfortunately, that was not the case, and as a result, this elderly woman has been hospitalized 4 times since July. Mr. Speaker, the minister has had 2 health budgets to make improvements. Why hasn't he increased funding to bring staffing in our nursing homes to a safe level?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I appreciate the member's question. As the member would know, we've convened a panel of 3 experts with experience in the area of long-term care. Mr. Speaker, they are going to be looking at a variety of aspects within the long-term care environment to provide some recommendations. We expect to hear back from them by the end of November. And Mr. Speaker, I'm pleased to let the member opposite know that over the past 3 or 4 years, in fact, the overall budget for long-term care services in our continuing care has increased, Mr. Speaker, not decreased, as she's asserted.
The honourable member for Cape Breton Centre.
Actually, Mr. Speaker, the budget for long-term care is decreased by $5 million, and that's no comfort to this daughter whose mother has fallen 4 times in a Glace Bay nursing home. Mr. Speaker, while I look forward to the result of the minister's expert panel, with all due respect, had this government been listening to the voices of residents, their loved ones, and nursing home staff and administrators for the past 5 years, instead of cutting $5 million from the budget, they wouldn't have to need to convene one. Rather than showing some leadership, this government has been allowing seniors to suffer preventable injuries like bed sores and falls, and that is disgraceful. Mr. Speaker, will the minister apologize to the residents of long-term care and their family members for neglecting their well-being?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Mr. Speaker, I believe the steps we've taken to investigate and respond to the concerns around pressure injuries in our long-term care facilities has been well received. I've been out to a number of long-term care facilities this summer to speak to staff within those facilities, as well as the administrators, to hear how the work that's been done, the educational information, the materials, additional supplies, Mr. Speaker, all positive steps forward to help them providing enhanced care to the residents of our long-term care facilities. And this work is ongoing and continuing.
Order, please.
Thank you.
The Honourable Minister of Health has the floor.
So, Mr. Speaker, as I'd said, the work that's ongoing will continue. We have the long-term care panel that we appointed a few weeks ago. Look forward to their feedback and recommendations on how to improve the quality of care within our long-term care facilities.